The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Welcome to Aging Horizons. On today's show, we'll be talking about Medicare. Well, the open enrollment period just passed December 8th, but there's a possibility if you chose a Part C plan that you can reevaluate it all the way up to March 31st and possibly change it. There's a couple other little minor changes that are happening in Medicare that can have a big impact in your life, and we'll be talking about those, so stay tuned.
Can you say ombudsman?
Ombudsman. Ombudsman?
Uma Doodlesman? Fortunately, you don't have to say it right to get the help of a long-term care ombudsman. If you or a loved one reside in assisted living or long-term care, an ombudsman can help resolve any issue. And these services are completely free and confidential. Now, why don't you try that again?
Ombudsman.
A decade of Montana fourth graders on Energy Share. When winter gets tough here in Montana, Lily Wallace knows who can help keep your home warm. Energy Share. That's right, says Livia Little. Energy Share wants to make sure that every Montanan stays warm, no matter how cold it gets outside. Thanks to Energy Share, we'll be cozy tonight. Energy Share is not a government program. It's neighbors helping neighbors who face energy emergencies the Montana way. Call or visit our website today. Energy Share is a good way to care.
Did you just text me?
I didn't want to disturb you if you were sleeping.
Sleeping? I'm sitting right next to you, silly.
There you are. Hey, I found a couple of Medicare helping programs online that I think we ought to look into.
It says if we qualify, we can get help paying for our prescription drugs. Oh, and there's a program that can help pay our Part B premium.
To learn more about extra help and Medicare savings programs, call your local SHIP counselor today.
Maybe I better text him.
Here in Montana, we love our outdoor activities. Unfortunately, few of them are risk-free. Indeed, Montana is second in the nation per capita in head injuries that can destroy the lives of people we love. That's why you should insist your family always wear protective helmets. But you can do even more. When you fill out your vehicle registration this year, circle the Y and donate $1 to support traumatic brain injury prevention and education. Now that's using the old noggin.
Welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services Senior and Long-Term Care Division. I'm your host, Brian Lamore, and we're talking about Medicare. Well, the deadline for changing or evaluating your plan for Medicare Part C and Part D has kind of come and gone. It was December 7th. But we have an opportunity between now and the end of March to evaluate those plans. Plus, there's a lot more little information, tidbits that you'd want to know about, which I mentioned earlier. Joining us today is Kimmy Everman. You're the social media and outreach person with DPHHS. I'd like to say, welcome to your show.
Thank you.
Well, let's start at the top. We're talking about Medicare Part C and some D plans.
Right.
We have until March 31st to evaluate that plan and possibly change it. What are the terms and conditions on that?
Well, I'm excited about a lot of things for 2023
Yes.
for Medicare, and this is certainly one of them as well. And it's just they're just really trying to simplify things for folks. Certainly, enrollment can be simplified and make people happy. Mm-hmm. And what you're going to do is, if you're in a Medicare Advantage plan right now, but you feel like, gosh, I missed the boat, I wish I would have switched during open enrollment and I didn't, you have from now until March 31st to get into a different Medicare Advantage plan if you want to.
So you need to be in a Medicare
That's
Advantage
right.
plan.
That's
you can't
right.
decide to get one.
That's right. But it's a pretty nice way to decide whether or not you really like what you have or you want to try something else. It's a nice, I think it's a nice option for folks. The other thing that you can do during this special enrollment period is if you are in that Medicare Advantage plan and you think, I think I'd like to go back to traditional Medicare and just get a Part D plan, or what we call the PDPs, the prescription drug plans.
Yes.
You can do that also so let's say that you're in a Medicare Advantage plan, and I don't know, maybe you have a doc that you want to see who isn't in that plan, but they do take Medicare. You can switch. Now remember, one time during a year can this kind of stuff happen. So you have to really, this would be a time to say, maybe I need to call a SHIP counselor.
Yeah, just thinking that.
and maybe get some more information for myself, and that person can help you figure out how to do your homework if you're not quite sure. Because you don't want to, just go back and forth. That's a lot of hassle for people, and it's uncomfortable. But you can do it once in the calendar year. And I think it just really is for folks who maybe feel like, oh, I didn't spend enough time thinking about this, and I really wish I had. So that's a really, like I said, a really nice option for folks. And then you're covered the next month. As soon as you sign up, you're covered the next month. So I think it's, as I said, I think it is a really nice option for folks.
So you reevaluated your plan by December 7th, and that kicks in January 1st.
That's right.
And then you have until March 31st to reevaluate your Part C plan.
Right.
You can't add it if you hadn't chosen it.
Right.
And but you could, I imagine, drop it, go back to the original Medicare.
Right.
Well, now we're talking about Part D, and what's really handy is we have a plan finder, and it's on the computer. But tell us more about that and how an individual can use that to better evaluate what meets their needs.
The plan finder, I am fortunate enough to have been there at the beginning, and now many years later, and it's evolved so much into such a great resource for folks. And in 2023, they've really they've made some improvements that will make it easier for them to update prices more quickly. So that a person that's looking for a plan will see as up-to-date pricing as possible. The plan finder is just at www.medicare.gov. Easy. There's a little tutorial there if you want to use that to use it yourself. Or you can call a SHIP counselor, and they will help you. And it's just a great big database that helps choose a plan for you based on the information that you feed in.
That's right. Now, when we talk about Plan D, that's prescriptions. Insulin products are considered a prescription, and there's some changes and details there. Tell us more.
Yeah, it's huge, Brian. Insulin products are now going to be capped starting in January right now at $35 per month. And what that just means is, let's say that you're a person who takes long-acting insulin, intermediate-acting, and short-acting all in 1 month. You can get each one of those for $35 per prescription. And that just has been such a great change. We have more that we're going to talk about in the next segment about that, so that I can give folks details. But we've really wanted to see this for a while, and I'm really happy to say it's here.
And I've seen elsewhere that they said the use of diabetic products is really, I'll say, exploding. It's a heavily used product, and for the government to say we're going to cover it at $35, it's wonderful.
Yeah, right? I think that's, we know of people who take half the amount or every other day. We've heard of these people, and so this is a way that we can start to really assure that people are getting as much of that medication as their doctor wants them to take.
So they can stay healthy and keep some of their wealth. And the government will cover the rest. Now, there's a few more details on the insulin, and we'll be talking about that in the next segment, so stay tuned.
Elder abuse is a growing problem, and it's happening right here in our Montana communities. At least 1 in 10 older adults are victims of physical or emotional abuse, financial exploitation, or neglect. To get help or report elder abuse, call your local area agency on aging or Adult Protective Services at 1-844-277-9300.
Every 65 seconds, someone is affected with Alzheimer's or other dementias. Many become isolated at a time when help is most needed. If you or someone you love is affected, help is available, both for people with memory loss and their caregivers. Memory loss can feel frightening, but you are not alone. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
You mean I can get help paying my prescription drug premiums?
Let me get this straight. I could be eligible for help with my family's prescription premiums even though I own my own home?
And our assets won't be counted.
If you're a Montana resident enrolled in the Medicare prescription drug program, you could be eligible for help paying your premiums. Call or visit the Big Sky RX website today to find out, even if you think you're over income.
What do you know about that? I'm eligible.
When I found out it was diabetes, my first thought was, Barb, you need help. You have to take control of this. There is help. My doctor gave me a phone number. I called and signed up with a diabetes educator. There is help. I have to put blinders on when I walk past the bakery counter. I can feel my blood sugar go up. You succeed a little at a time. If you have diabetes, help is available. You do not have to do it alone.
Ask your doctor about diabetes education or visit montana211.org.
Welcome back to Aging Horizons. I'm your host, Brian Lamore, and we're continuing our discussion about Medicare, particularly some unusual circumstances or some benefits that are happening in 2023. Now, Kimmy, we were talking about insulin when we left, but there's some more fine details on that, and that's how it has changed with, I guess, our new government.
Right. Well, and again, before, I just want to say again that it's such a thrill to know that the insulin price is going to be capped. That it's just, that's so good for so many of our beneficiaries. Yes. So very happy that this is going to happen. But I want to just point out that there might be a few hiccups at the beginning, and so I want to just let our viewers know what we already know might happen.
Yeah.
Okay? Because it was a very recent decision to do this, people at Medicare weren't able to get all the ducks in a row. So what they did was they told all the providers, the Part D providers, you have until March to get this correct pricing into your system of $35. So let's say I go in January and I get to the counter and my insulin is not 35, it's 70. But I know it's supposed to be 35. That's probably just because the pharmacy hasn't gotten it into their system yet.
Yeah.
And they are required to pay you back or reimburse you that extra $35 by March of this year, 31st. So it isn't like you're not going to be getting the right price, but because it's, as I said, because it's such a recent decision, it might not be in the pharmacy system yet, but they do have to reimburse you if they charge you more than $35. And I think your best bet is to just talk to your pharmacist and find out whether or not they're going to be able to honor that price right away. Real easy. The worst they can say is no, and in the end, you get back your money. So that's very, very important to know. And if you run into it and you don't know what else to do, call a SHIP counselor.
Call a SHIP counselor and let them know.
Yep.
Well, I imagine that when they're going to be reimbursing the individual, the amount they charged over 35 up until March 31st, they have to give that money back.
Right.
What's important is to have your address. And people change their addresses. They might not tell their drugstore. Maybe they don't tell Medicare. Why is this important?
Well, especially folks that might be getting some of our, be on some of our programs, the LIS or the MSP. In the last few years, the world's been crazy and people have moved, and we don't want folks to not have all that information updated in the places where their benefits might be coming from, because we don't want them to have to wait if we don't have their new address or their new phone.
Yeah.
So, and that has a lot to do with the public health emergency and the fact that we're still in it, and we just want to make sure that anybody that has a benefit coming in, stay in touch. And you know what? Call the SHIP counselor.
Yes.
Put the number up. They will help you understand who you need to talk to, if anybody, and get you on the right track. They're really just there to make sure that that's all going to go smoothly for you. And I also, before we move on, I want to mention too, regarding the insulin and the drug or the plan finder, if you use the Medicare plan finder yourself, you may look for a plan that has insulin, but you shouldn't count that price in. You should figure it's going to be $35. Again, because this was such a quick turnaround, they weren't able to get the plan finder set up to use that correct pricing on the insulin yet. So you may use the plan finder and say, hey, wait a minute, I know that's supposed to be capped. Don't even look at it. Talk to your pharmacist.
Right, yeah. Well, another topic that we'd like to touch on is exceptional circumstances for signing up for Medicare. Tell us what some of them are and why we have exceptional circumstances.
Well, as I was telling you, we ran into a few of these during the last few sort of hurricanes and things natural disasters that have happened in our country. You may be in a natural disaster and your neighborhood's wiped out, and you aren't thinking about going to get your Medicare at that point.
Right.
So you should always remember that if something happens like that to you, in 2023, Medicare has updated their criteria for these special circumstances. They're on a case. The reason I can't give a whole list is they're a case-by-case basis, which is better than a list anyway.
Yeah.
Because that means you can call and say, I have had this happen. Can you help me?
Can you help me? And is this a disaster, statewide, countywide, or is this something that happens to an individual?
Because it's a case-by-case basis, I would ask that question.
Okay.
Certainly it's the county-wide and the nationwide and all that, but if I thought I had a special circumstance, I would ask.
Well, I think you mentioned off camera that a person was in a coma, so couldn't make payments and got dropped. But that's a unique circumstance.
It is, and so ask. The worst they can say is no.
Right. And the people you ask is your SHIP counselor.
That's right.
We have SHIP counselors throughout the state. They're really very well versed on Medicare, what can and can't happen. And if they have a question, they call up people like Kimmy or our friend Janet. And they can go to next step up to national people to find out what the situation is and what the solution can be. And they're working for you. That's what's important. We got a lot of great information coming up again, so stay tuned.
Respite care is amazing. If you are capable of doing it, the rewards are beyond measure.
Stephanie Young, respite care provider, on the unexpected benefits of helping people in need.
Being a respite care provider is an amazing experience. It's something that what you give, you get back 100-fold. You receive so much more than you could ever imagine.
To find out how to change lives, including your own, go to respite.mt.gov.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare summary notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
I've been shooting since I was young. It's something I've always enjoyed. I wasn't feeling like myself, and my friend noticed. He asked if he could hold onto my guns temporarily. At first, I was a little shocked, but then I agreed. I think he saved my life that day.
Welcome back to Aging Horizons. We're talking Medicare with Kimmy Everman, who's the DPHHS social media and outreach person. And Kimmy, you know, we've always talked about special programs that are available to individuals to help with their Medicare payments. And there's some subtle changes that are happening in 2023. What are some of those? What do we need to be aware of?
Well, I think I want to talk about, first of all, the low-income subsidy, or we've called it extra help. It's also, or it's designed to help folks with their Part D. And we know that Part D is the prescription drug plans. So in the LIS, or the low-income subsidy program in 2023, they will, anybody who's been on that program knows there's a benchmark that comes with your eligibility. And the benchmark is just saying, okay, person who's eligible, you may choose any plan that is under this benchmark, because we will pay the benchmark, okay? And there's lots of plans that are under that. And what I found when I was reading yesterday that made me so happy is that plans that you pick now in 2023 that are below the benchmark, you pay zero. So it doesn't matter what it says in the the plan finder, I guess, or the Medicare and You book, you're paying zero if you're a full low-income subsidy beneficiary.
Great.
So, and that's just the main one, but there's all kinds of little tweaks like this for everyone. So if you think that there's any possibility that you might be eligible for a low-income subsidy benefit, talk to your SHIP counselor. It doesn't matter whether you are or not. If you think you might be, you should try. That's the best way to go forward with that. And then also there's still the Medicare savings plan, which pays Part B premiums. And remember, B is our outpatient coverage. And so you don't want to forget that that's there. Again, you can always call a SHIP counselor and they can help you figure out where to get the paperwork to fill out or whatever. If you need help, they'll help you. And that will pay for that monthly premium of the Part B coverage, and some out-of-pocket expenses as well, again for the full eligibles. But there's also there's tiers of eligibility, so you want to check it out and make sure, even though you might think I've never been eligible before. And the one I want to talk about with that is we've got Big Sky RX. Big Sky RX, again, is a Part D specific benefit, And what it does is, again, it will have a benchmark, and it will probably follow the Medicare LIS benchmark. It'll probably be the same. And anything under that you can choose, and the Big Sky RX will pay it for you. And I think one of the things folks like to know about Big Sky RX is that it's very much a homegrown plan or program. We have great people that have been working on it for a long time, and you can have more, they don't care about your assets so much. It's just a matter of how much income that you have, but you can have a house and a car and a boat if that's the deal. It's a way of reaching out to folks that are of a little bit higher income that can't usually get any kind of benefit to help them out, even though they probably need it.
Oh, yeah.
So very good benefit.
You know, the thing I'd like to point out is that it may sound a little complicated, these programs. You can get the information, but many times people look at one program, I'm not eligible, and they won't go for the others. Contact your senior and long-term care SHIP person with the 800 number on the screen. And what's important is that they also know other programs that are offered to seniors through your area agencies on aging throughout the state of Montana.
Right.
So you can talk to them and you can get other benefits that might be unknown to you right now.
Right.
But now, Kimmy, another thing that's happening is that we're looking at negotiating prescription drugs at a federal level. Tell us more about the details and how that's a benefit.
Well, I know that I'm very excited about it. Having been at the sort of remake of Medicare since 2006, it's exciting. In 2026, they will be able to start negotiating drug prices, which just means that they are going to try to be able to find you better prices by negotiating with companies. You know, we'll buy 100,000 of those pills if you give it to us for a better price. And that will help everyone. Very exciting. Can't wait to see how it goes. But I think it's been a long time coming, and I'm really proud of Medicare for getting that into the mix.
And I believe the veterans' homes, I think they negotiate.
They do.
That's good.
Yes, exactly, and that's really one of the reasons we've all said, if they can do it for the veterans, we can do it for others. On Medicare.
And as I understand, we pay some of the highest drug costs in the world.
The United States certainly does.
We do. So, well, Kimmy, I'd like to thank you for coming in and updating us on everything's happening in the new year. And for many of our viewers, Happy New Year. And to you, too.
Thank you.
And for our viewers, you know, we'll continue giving you updates on what's happening with Medicare, Medicaid. What are some of the details? What are some of the plans that can help you out? We want to keep you informed so that you can make the best decisions you can. And of course, we have our SHIP counselors who will assist you in making those decisions. You make the decision, they don't, but they give you all the information that can assist you to make a good, well-informed decision. And this is more of our state helping our seniors and helping them to live longer and happier lives. So thank you for joining us.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.